Hey, what's up, everyone? This is Julie Reynolds, aka Nurse Jar. In this training video, I'll be demonstrating the 2022 Pearson View and Credentia testable skill applies one knee-high elastic stocking. This skill is performed on a mannequin. However, there may be situations in when you will have to perform this skill on a live person. One, if the mannequin's foot is too big at the testing site, you'll have to perform the skill on a live person. Or two, if the mannequin's foot is too wobbly, you'll have to perform it on a live person. But the nurse aid evaluator will inform you of such, okay? So normally the skill is performed on a mannequin. So let's go ahead and get started. Hi, good morning, Mrs. Jones. How are you? Awesome. I'm Julie. I'm your CNA, and today I'm going to be putting on your stocking, okay? All right, Mrs. Jones. I just want to make sure that your bed is in a low, safe position, and it is. I'm going to go ahead and lower your head of bed because I need you to be in supine position when I'm placing the stocking, okay? There we go. Your bed wheels are locked. I'm going to give you your call light in your hand. There you are. I'm going to go provide you with privacy by closing your privacy curtain, okay? Okay, Mrs. Jones, before I go wash my hands and gather my supplies, is there anything I can do for you? All right, Mrs. Jones, I'll be right back, okay? Washing hands. Now I'll go gather my supply, and the only supply that you will need to gather will be one knee-high elastic stocking. Hi, Mrs. Jones. I'm back with my stocking. I'm going to go ahead and get started, okay? I'll be placing the stocking on your right leg, okay? All right, Mrs. Jones. So the first thing that you want to do is uncover whatever leg you're going to be placing the stocking on. You uncover only that leg because you do not want to overexpose the person. Mrs. Jones, I'm just uncovering your leg. There we go. I'm just going to straighten your leg out. There we go. All right. Now, some people like to apply the stocking while standing at the side of the bed, or you can stand at the foot of the bed to apply the stocking. I like standing at the foot of the bed because it's just more convenient for me to do it that way, okay? The first thing that you'll need to do before you apply the stocking on the person's leg is to turn the stocking inside out. The easiest way to do that is to place your hand inside the stocking, and you can see the blue heel, okay, right here. Some stockings will have a white heel, but you'll be able to determine where that heel is, okay? And what I'm going to do is I'm going to pinch at the bottom of that heel, okay, the edge that's closest to me. I'm going to hold that pinch, and then I'm going to turn the stocking inside out, okay, just like this. Now, this is elastic, okay, so it stretches really wide. So when you stretch the stocking and place it on the person's foot, you want to make sure that you keep that stretch, okay, hold that stretch. It'll make the stocking go on much easier, okay. All right, Mrs. Jones, I've turned the stocking inside out. Now I'm going to begin placing it on your foot, okay. I'm just going to stretch it out really good. There we go. And now I'm going to place it on your foot. Whenever lifting the foot off of the bed, you'll need to make sure you support underneath the ankle joint, okay? Mrs. Jones, I'm just going to lift your foot off of the bed and pull the stocking over your heel. Okay, so once you place the stocking, it specifically states to place it over the toes and over the heel. All right, Mrs. Jones, I'm just going to pull the stocking up your leg. The easiest way to do this is to take your thumbs and bring them down, all the way down the stocking, and then you're going to support underneath the ankle joint when you lift and bring it up over the heel. Then you can place the foot back down, okay? What I do right now is to check to see if the heel of the stocking is covering the heel of the person's foot before you actually raise the stocking up the leg. Mrs. Jones, I'm just going to lift your leg, supporting underneath your ankle joint, because I just want to make sure that the heel of the stocking is covering the heel of your foot. And it is. All right. And I'm just going to pull the stocking up over your leg, okay? There we go. Just going to make sure I get out all the wrinkles, because the stocking needs to be wrinkle free. So that is the critical element of this step. Okay, one, the heel of the stocking has to be covering the heel of the person's foot, and the stocking has to be wrinkle free. If you're having a hard time getting out all the wrinkles and twists, all you need to state is the stocking should be wrinkle free, or the stocking is wrinkle free, and you'll get credit for that critical element step, okay? The toe of the stocking, it can either be closed or opened. Once you get the stocking on the person's foot, you'll cover their leg back up. And then you'll go ahead and do your closing procedures. Mrs. Jones, I'm all done. Is there anything that I can get for you before I leave? Okay. Well, you still have your call light in your hand. Your bed is still in a low safe position. Bed wheels are locked. Privacy is maintained. Mrs. Jones, you have a very good day, okay? All right, thank you. Then you'll verbalize washing hands. Wait a few seconds. Go back through all of your actions that you did, right? Just take a couple of seconds to do that, just to make sure that you did not perform a step incorrectly or you did not omit a step, okay? Because once you say skill complete, you cannot make any self-corrections. Once you feel good about your performance, then go ahead and verbalize again, washing hands, skill complete.